Hey everyone, we've got another heart today. This is number 904 in our collection. The heart would have sat roughly in the chest like this. Anterior surface coming out towards the screen, posterior surface towards the turntable, head or superior here, legs or inferior here, left and right. We'll start off as we usually do, which is by trying to identify what appears to be the right atrial appendage. And externally, at least, this appears to be the right atrial appendage. It is broad-based, it is pyramidal in shape, or triangular in shape. So we'll go ahead and open up the heart there. And we do find pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. We do also then find the oval fossa, which appears intact in this heart. And then we also find the superior caval vein here, entering into the right atrium. Going back into the right atrium, we do also find the coronary sinus, which is right here. And you can see the trapezian valve, which guards the coronary sinus. So the coronary sinus is here, and the trapezian valve is right here. And then an important structure to note whenever we're around the coronary sinus is the triangle of Koch, which remember is bounded by the coronary sinus, the tendon of Todaro, as well as the right AV valve. And at the apex of this triangle is going to be where we find the atrioventricular node. So here's the apex where we would expect to find the AV node. Now, we do find a right-sided atrioventricular valve that appears to have 3 leaflets. This valve does have connections to the ventricular septum, consistent with a morphologic tricuspid valve. The ventricle itself has coarse trabeculations, and there is a septomarginal trabeculation, and here is the septomarginal trabeculation. Here is the Y of the septal band, the cranial and the caudal limbs of the septomarginal trabeculation. Now, behind this tricuspid valve leaflet, there is a ventricular septal defect. So this is a central perimembranous ventricular septal defect. We'll turn our attention back to the right ventricular outflow tract. We find a semilunar valve here with 3 leaflets and 3 sinuses, 1, 2, and 3. You can see that this entire valve is supported by muscle. And important to note that the semilunar valve doesn't truly have an oval or round-shaped annulus. It in fact has this semilunar appearance. And so in fact, when it comes to the semilunar valves, the actual annulus is a man-made construct. That's not to say it's not a helpful tool, especially for interventional management, but the true annulus is actually somewhat crown-shaped here. Nonetheless, we have a pulmonary valve here that leads to a pulmonary trunk, and we can see that the pulmonary arteries have been transected. We'll go ahead and turn this heart to its back. And here we find another atrium. This atrium is smooth-walled. There are no pectinate muscles outside the confines of the appendage, consistent with the morphologic left atrium. Once again, we see the oval fossa is in fact intact, and there is no atrial septal defect. This is the orifice to the left atrial appendage here, and we can find the finger-like left atrial appendage here. And it's hard to see inside it, but we would find that there are pectinate muscles, and all the pectinate muscles will be confined within this appendage itself. We do come to this left-sided atrioventricular valve now. It does have 2 leaflets, an anterior leaflet and a posterior leaflet here. And this valve does not have any connections to the ventricular septum, consistent with a morphologic mitral valve. So here's the mitral valve, here's the anterior leaflet, here's the posterior leaflet, here's a papillary muscle, and here is the other papillary muscle. We would then expect that this valve would open up into a morphologic left ventricle. This ventricle does have fine crisscross trabeculations consistent with the morphologic left ventricle. And as we get into the outflow tract here, we can appreciate that central perimembranous ventricular septal defect that we saw from the right-hand side earlier. Here we find another semilunar valve now, also with 3 leaflets and 3 sinuses. And here we can see that this semilunar valve is not entirely supported by muscle. There is fibrous continuity here between the anterior leaflet of the mitral valve and this leaflet of this semilunar valve, which in fact is an aortic valve. We can find coronary arteries arising from within the sinuses, consistent with an aortic valve as well. And here we do see the ascending aorta as well. And as we look at this aorta, we find that there is a suture line here, which appears that this heart did have an interrupted aortic arch that was surgically repaired. So we have a heart here that has interrupted aortic arch, as well as a central perimembranous ventricular septal defect.